I have multiple injuries and deterioration throughout my body, but my low back was so bad that I had reached a point where I had actually went to my primary care physician and asked for a prescription for a motorized wheelchair. Before anything could really be emphasized, I was denied, and right after that I got so bad that in my small bedroom I could hardly make it into the next room. And I had taken the number down from the infomercial about the DRX 9000, and I was going to call before that because of my pain and the increasing disability in my legs, very difficult to walk. Most of the time in my Christian gatherings I would arrive with a cane. Many times I couldn't make it. Just normal things became impossible. So as I reached my highest rate of disability, I remembered that phone number, and I found it, and I called and arranged for an interview. And I was on my very first treatment. I felt a little bit of stress or pressure reduced. By the time I was halfway finished through the program, I remember I was walking a lot better, but I didn't think how much I had mobility I had really gained. One day I was on my way in my van for my treatment. I remembered I'd forgotten my back brace. So I drove back to my home, got out of my van, and ran through my house, picked up the brace, ran back, got in my van, and then just sat there stunned, realizing that with no effort I ran and there was no pain. Now, I'm not saying every day was completely pain-free, but I continued to improve. And although I wasn't cleared for running then, there are days when I feel that I can. And I certainly can walk. And I have noticed that with the program, along with the DRX 9000 that Dr. Palmer has set in motion, when I follow the guidelines, I'm so much better that my life is finally back to where I can say that I have a life. And my friends now are used to me arriving different places without a cane, and I'm really pleased. Yes, over the years, the treatment that I received was on my low back, and I'm in my 60s now, but when I was in my middle 20s, x-rays revealed that the space, there was 50% degeneration back then. By the time I got my MRI before I started the DRX 9000, I almost didn't have anything left between my vertebrae and my L5 into the sacrum. So I had continued to go to chiropractors, and I also had received pain medication through the regular health care because I couldn't. Also, I'd had therapies that didn't seem to help, and I had reached the point where nothing was helping, and this was my last-ditch effort to see if I could gain some type of normal life again. Well, I was impressed. In fact, when I came in, I found out I wasn't alone. There were a lot of people, and I talked with people before I actually got my first treatment. There was someone that was coming back for their second series. Their neck had been helped so much, and now they were coming back to do their low back. And so as I was waiting to get on the DRX 9000, I got a chance to talk with others that were getting good results too. So I was a little nervous, but this was such a phenomenal thing. In no way could it be compared with traction, which I was always afraid to go through, and I never did have. This was something that put my mind at ease, because I found that it was geared to sense your body's reaction to the treatment, and if I were to need to back off, all I'd have to do was push a little button. In fact, before I even pushed the button, the machine itself would back off. But I was just really happy with the fact that I wasn't having to be made uncomfortable for this treatment.